Hi everyone, I hope you're doing good today. I wanted to go ahead and do my video early because I am going through a gastroparesis flare-up and I'm not feeling too good. So this isn't going to be the longest video, but I did definitely want to get something out there today. Today I do want to talk about Stoma Care. The stoma is the opening where the feeding tube is inserted in your abdomen. That stoma is pretty much like a permanent open wound, and so you want to take care of that area so that bacteria doesn't get into it and it doesn't get infected. Getting an infection can be painful, obviously make you sick, and if it's not taken care of right away, it can make you septic, and we all know sepsis can kill you. So you always want to take good care of it. The way most feeding tubes are, they have like this plastic ring that is on the outside, right outside, and directly contact with your skin. You want to put something in between that ring and your skin to protect your skin from getting irritated from that ring and to absorb any discharge. No matter how long you've had your feeding tube, you could have had your feeding tube for 20 years, you're always going to have a little bit of discharge with your feeding tube. If you have a G-tube or a GJ tube, it can actually be gastric fluid, which we all know is acidic and can irritate your skin. So you definitely want something there that's gonna pull it away from your skin and protect it. And the third reason is to try and prevent as much movement as possible of the feeding tube at the stoma site, because that can develop granulation tissue if you have too much movement. And I'll touch base on granulation tissue as we go along. So for Stoma Care, the first thing you want to do is you want to wash your hands. You want to make sure everything is clean and sterile, and you minimize the possibility of introducing bacteria to your stoma. There are different ways to protect your skin, through that barrier, as I was talking about, to put between your skin and that barrier. One way, the old medical way, what the insurance paid for, it's called a gauze sponge dressing. It has a split so that you can just put it over the tube behind that stopper and it'll sit there. The problem with this is, as you see, it stays open. So if you move and your shirt moves, it can move and it can come off and not really do what it needs to do. So if you do use these, what I used to do is I would just take a small piece of tape and tape the top, and that would keep it on there for me. They come two in a pack. I've always been told to use both just because it's better, it's more absorbency, and gives you more space between your skin and that barrier. The other way is to use 2B pads. Don't know who invented these, but they are everywhere. You can search Etsy, you can search Facebook, you can do a Google search, put J-tube pads or G-tube pads, and you're going to get a long list. I pay $1 for mine from someone off of Facebook. It's GOTZ G pads. It's GOTZ pads, PADZ. She does very good work. I got these literally a week after I ordered them and paid for them. And she has all sorts of different materials, so you can pick, I picked Ariel, or you can pick like a zebra print or other things like that. There is a couple of companies, rather than making them in circles, they make them in shapes. Like if you want like an awareness ribbon one, it would be in the shape of a awareness ribbon, and you could put that there. The thing that I like is that most of these companies will put a closure, whether it's Velcro or a button like this. That way it ensures that it stays. If you have an excessive amount of drainage, I would recommend sticking with the gauze pads, especially if you have to change it 3 to 4 times a day, because it's just going to soak right through these, and then it'll get on your clothes, and you're not going to, it's not bad, but it would just be better to have these and change them 3 times a day and just throw it away rather than, you know, buying 60 of these so that you can change it 4 times a day, you know. So, like I said, you can search Google, at Etsy, Facebook, they're all over the place. So, the first step when I am changing my dressing or cleaning my stoma or whatever is to wash my hands. Or use hand sanitizer or something like that, but you want to make sure it's clean so there's no bacteria. And I will simply remove my old one. And I usually use some sterile water, saline water, on a piece of gauze and just wipe around it. And then just place my new one. And then I'm done. Now, the other thing that a lot of doctors could recommend is putting some type of cream on there. Like at the hospital, they gave me a skin barrier cream, or you can use regular Vaseline, or you can use triple antibiotic ointment. That's just if you have more sensitive skin, and even with a 2B pad or the gauze, you are still getting irritation. I never do this with my hands. I always get a sterile cotton swab, and I use that. Just to make sure everything is sterile. Now, as I mentioned before, the reason that a big reason that you put the barrier, whether it's the cream or the gauze dressings or the 2B pads or a combination, is it helps reduce your granulation tissue. Granulation tissue is fresh tissue that is trying to heal the wound, so it's growing so that it could close the wound. That fresh tissue has the blood vessels and the nerve endings right sitting at the top of the tissue. So it can be very painful, it can bleed quite a bit, all around. It's just a nuisance to a 2B. For most people, they realize it once it's grown out, and for a lot of people, you'll see like a big, you know, pink, like little ball just sitting there. But granulation tissue is quite painful. The only way currently that most people use to remove granulation tissue is to use a stick of silver nitrate. What it is you just touch it to the granulation tissue, and this literally burns it off. It is extremely painful, but one of the few ways that guarantees it. Some people use steroid creams. There is now a company called Granulation, Granu lotion. They sent me a sample of it, and unfortunately my skin did not agree with it. So I don't know if it really works for granulation tissue or not. I have very sensitive skin, and it just reacted badly, so I had to stop using it. And there's you can research other ways to try and get rid of it, but the only surefire way right now to get rid of it is the silver nitrate, and it's not fun. It's painful for a good 15 to 20 minutes, and then it scabs up, and that's still a little bit painful, but by the next day, your granulation tissue is gone. It's not fun, and having a feeding tube is hard enough, and on top of that, doing this just sucks. But if you take good care of your stoma, if you minimize the movement of your feeding tube, so if you have a long tube rather than a button, if you tape up the long tube so that it stops moving, You'll reduce the amount of granulation tissue that you get. Keeping it clean is a big thing. Making sure you have that barrier between, the plastic ring and your skin, and making sure that all the discharge is soaked up rather than just sitting there. Those are all things that can help prevent it, and prevent you from getting an infection. So that's it for today. If you guys have any questions, please feel free to let me know. Tomorrow, I think I'll be touching base on just regular feeding tube care and a couple of questions that have come my way. If there's anything else, though, specifically, please just let me know and I will get to it. Hope you guys have a good day. Thank you.